Informed consent changes all the time, and I think it's really difficult. A few years ago, we talked about the Bolam test, and then there was the Blytho test, and now there are different tests. I can't even remember the name for them. And the way that things change and move along makes it really difficult. I'll give you an example. I'm an anaesthetist. We know that the chance of death following an anaesthetic, solely due to the anaesthetic, is very almost too small to even calculate. It's a safe activity, and I always tell patients you're safer having one of my anaesthetics than you are driving home after you've had your operation, particularly if you drive yourself. We'll get someone else to drive, remember that. But the problem with that is, when you're talking with somebody about consent for an anaesthetic, do you say, well, actually there's a chance of death? What does that do to somebody's state of mind if they're coming in for a relatively routine surgery, which almost everybody is going to survive, except maybe one person every 5 years on a national basis? How do you talk about that sort of thing to somebody who's actually anxious enough about everything else? And that's just one example of things that are really difficult. We could, for example, say, should we say to patients, well, you don't have to have an anaesthetic. Don't forget, surgery's been practiced for thousands of years before anaesthesia was invented. Should we offer that as a valid choice? We're even discussing that as a profession. There are some real big minefields in informed consent. And do you know what? We really need the space to be able to talk and learn about them.